All right, let's cut right through the noise and jump straight into things today. We are unpacking an absolute master of deception in the microbial world, Hantavirus. Now, this is a rare but seriously intense pathogen, and what's crazy is it doesn't even rely on contagious human-to-human transmission. Instead, it literally lurks in places we barely give a second thought to. So let's unravel this invisible threat together. Okay, let's dive into this because I want you to think about this for a second. What on earth connects an everyday, completely mundane household object, like a dusty broom, to a literal life-threatening fever? Like, how can just sweeping out an old summer cabin unexpectedly land you in the ICU? Well, the answer lies in the unseen world around us. And to really grasp it, we need to properly define exactly what we're up against. So let's get our definitions straight. Hantavirus is a rare but intensely serious disease caused by a specific group of viruses in the Bunyaviridae family. Now, unlike viruses that spread through coughs and sneezes on a crowded subway train, this particular family of viruses has a very specific primary vehicle for getting around: rodents. Rats and mice are the natural reservoirs here. So for us, understanding hantavirus really means understanding that the danger isn't necessarily walking through your front door, it's often scurrying right under the floorboards. And to really get this virus, we've got to look back at the history. During the Korean War, between 1950 and 1953, thousands of soldiers fell ill with this totally mysterious fever near the Hanton River, which, by the way, is exactly how hantavirus got its name. Decades later, fast forward to 1993, and the virus shocked the medical community all over again, with a severe lung disease outbreak in the American Southwest. That proved this threat isn't just something far away. It's right in our own backyards, too. Now, what's really interesting about this specific cast of characters here is that we aren't talking about some rare exotic wildlife. We are dealing with everyday rodents. In the Americas, your prime carriers are the deer mouse, the cotton rat, the rice rat, and the white-footed mouse. Recognizing these specific carriers is absolutely step one in understanding the ecological map of this disease, mainly because they live in fields, forests, and literally right alongside rural human habitats. But honestly, here is the wildest part of the whole thing. The rodents themselves, they usually don't even get sick. A deer mouse carrying a lethal strain of hantavirus acts perfectly healthy, living its best life, all while shedding massive amounts of the virus in its urine, droppings, and saliva. It is a really stark contrast between their harmless, kind of cute appearance and the deadly threat they pose to us. And that threat operates on a remarkably delayed fuse. Just look at this number, 8. The incubation period for hantavirus is incredibly deceptive, ranging anywhere from 1 to a maximum of 8 weeks after exposure. Think about that. You could spend a weekend in a dusty, rural cabin, breathe in the virus, and feel perfectly fine for almost 2 months. You've completely forgotten the exposure before the virus suddenly strikes. This super long incubation makes tracing the actual source a massive challenge for doctors. Let's move along and see how this builds, because how exactly does the virus jump from a healthy-looking mouse into a human being? Well, it can happen through direct contact, a super rare bite, or eating contaminated food. But the absolute #1 most common mode of transmission is inhalation. And guys, this brings us right back to that dusty broom we talked about earlier, because the real danger is literally in the dust. When rodent urine or droppings dry out over time, the virus particles inside them are perfectly preserved. If you walk into an old barn or a storage unit and just start sweeping away, you inadvertently aerosolize that material. Literally, simply by taking a deep breath while you're trying to tidy up, you are inhaling the pathogen deep down into your lungs. It's an almost invisible, entirely accidental exposure. Once it actually gets inside the human body, the virus basically takes a fork in the road depending on the strain and geography. Over in the Americas, we primarily see hantavirus pulmonary syndrome, or HPS. As you'd guess from the name, this heavily targets the lungs, leading to severe fluid buildup. But on the other side of the world, mostly in Asia and Europe, the virus manifests as hemorrhagic fever with renal syndrome, or HFRS. That variant attacks the kidneys and vascular system, causing massive fever and bleeding issues. And this brilliantly illustrates how the virus dangerously mimics something totally common. The early symptoms, fever, chills, severe fatigue, and muscle pain, are completely nonspecific. It feels just like the flu. But then, after a few days, the advanced symptoms crash over the patient. For HPS, this means terrifying shortness of breath as fluid literally floods the lungs. For HFRS, it means reduced urine output and plummeting blood pressure. It escalates from, "I think I have a cold," to a fight for survival in a matter of hours. If the disease advances, those severe complications are incredibly grim. We're talking catastrophic respiratory failure, profound shock, total organ failure, and a very high mortality rate. In the case of hantavirus pulmonary syndrome specifically, mortality can exceed a third of all recognized cases. It is a medical emergency of the absolute highest order. Because the early signs are so incredibly vague, doctors basically have to act as medical detectives to properly diagnose it. It always starts with a thorough medical history. Have you been in any rural areas or seen signs of rodents in the last 8 weeks? From there, physical exams check for breathing distress, followed by highly specific laboratory tests, like blood panels, antibody checks, or PCR tests to sniff out that viral RNA. Finally, imaging like a chest X-ray can reveal that hallmark fluid accumulating in the lungs. So the crucial point is this, and honestly, it's a sobering one. Modern medicine currently has absolutely no specific cure or targeted antiviral treatment for most hantavirus infections. When a patient arrives at the hospital, the medical team isn't focused on a direct cure. They are entirely focused on buying the patient's own immune system enough time to fight off the virus itself. Without that magic bullet cure, treatment relies 100% on aggressive, early supportive care. This means intensive oxygen therapy to help out those struggling lungs, IV fluids to maintain hydration and kidney function, really powerful medications for blood pressure support, and in severe cases, mechanical ventilation to literally breathe for the patient while their immune system goes to war with the virus. Understanding exactly where this threat lives is just as important as knowing what it does. High-risk areas include your rural regions, farms, deep forest areas, and places with poor sanitation. And keep in mind, this risk isn't static. Outbreaks predictably surge worldwide whenever environmental factors, like a season of heavy rainfall, cause local rodent populations to explode. Basically, more mice simply means more virus out in the environment. Fortunately, though, because we know exactly how this virus spreads, prevention is highly effective and really straightforward. If you're ever cleaning a risky area, just follow these exact steps. First, throw on some gloves and a high-quality mask. Second, and this is key, never, ever sweep dry droppings. Instead, completely soak the area with a disinfectant or bleach solution and just let it sit for a bit. Finally, use wet cleaning methods like wet paper towels to wipe it all up. That keeps the dust and the virus out of the air entirely. Hantavirus is a profound reminder that some of our greatest threats aren't the loudest or the most obvious ones. It's a disease where public awareness, simple cleanliness, and early detection are quite literally the difference between life and death. The knowledge we've unpacked today empowers you to safely navigate those dusty, forgotten corners of the world. So the next time you go to grab a broom, are you prepared to respect and protect yourself against the unseen microscopic threats in your environment? Thanks for joining me on this explainer. Stay curious, stay focused, and stay safe.